on the live stream. So I'm Jackie Schultz. I'm one of the providers here at the Strasburg office. I'm a physician assistant. And today I'm going to be talking about metabolic syndrome. So the reason I picked this topic is because it's really prevalent in the United States and growing in numbers in other developing and developed nations. So it's really important. It's also very preventable and treatable using holistic lifestyle modifications, supplements and things like that. Prior to working at Turnpaugh, I worked for several years in the emergency department. So unfortunately I saw a lot of the unfortunate things that can happen with metabolic syndrome, things like heart attacks, strokes, diabetic emergencies. So it's been really a privilege to be able to work on the other side of the table and be able to teach patients and explain different ways that we can help to reverse this or even prevent it. So I've really enjoyed being here. So this is going to be really casual. If you have any questions, raise your hand or just shout out a question. I'll try to answer the best that I can. Okay, so first we'll talk about what is metabolic syndrome. So we're going to go over the key components of it. Then we'll talk about risk factors, root cause, and some prevention and treatment options. But to start, so metabolic syndrome, the definition is this is a cluster of conditions that happen together that put you at risk for heart disease, stroke, or type 2 diabetes. And the key components of this, you need to meet 3 of the 5 listed criteria here to be actually diagnosed with metabolic syndrome. So the first one is abdominal obesity. This is a waist circumference of over 40 inches in men and over 35 inches in women. Why does abdominal obesity matter rather than just obesity in general? That's because most of our organs sit in our abdominal cavity, and when we have a lot of fat around our organs, that's called visceral fat, and this can be a lot more inflammatory than other types of fat because it actually secretes cytokines, which are inflammatory cells. So that's why specifically abdominal obesity is on there. Insulin resistance is another one. So this is having a fasting glucose of greater than or equal to 100 or taking a medication to lower your glucose. And just a really quick explanation of what insulin resistance is. So anytime we eat sugar, and that's any food that has sugar in it, not just what you think of like cookies and pies and things like that, but even a lot of our whole foods like vegetables contain some amount of sugar. So certainly those are good things to be eating, but we just don't need added sugar. And there's so much added sugar in this day and age. So when we eat food that has sugar, our pancreas secretes a hormone called insulin, and that's what gets the sugar out of our blood and into our cells to be used as energy, because that's what glucose is really for. So when you have insulin resistance, you can imagine you have like 2 really strong people on the back of the cell wall door pushing against it, not letting that glucose in. So that glucose is out in our bloodstream, and long term that is what type 2 diabetes is. High blood pressure. High blood pressure can be caused by a lot of different things, but generally speaking, our blood vessels are supposed to be nice and stretchy and flexible so that blood can easily flow through. And when we have a lot of plaquing from inflammation and high cholesterol and things like that, it can cause our vessels to be more rigid, and this can raise our blood pressure. Along with having high cortisol, if you're always stressed out, your cortisol being high can also keep your blood pressure high. Triglycerides, so having triglycerides of greater than or equal to 150 is another key component. Triglycerides are a fat. When you eat sugar, our liver turns them into fat. So those are what triglycerides are. And then having a low HDL cholesterol. HDL is our high density lipoprotein. That's our good cholesterol. So having a low good cholesterol, for men this would be under 40, for women under 50 milligrams per deciliter. Those are the key components of metabolic syndrome. Interestingly, having a high LDL is not on here, so low density lipoprotein or our bad cholesterol we hear a lot about. But having a high LDL in itself is not necessarily a risk factor for strokes and heart attacks and things like that. It can be, but generally speaking, it would be in combination with some of these other things like high sugar and inflammation and things like that. And like I said, this is very prevalent. It affects 1 in 3 Americans, and also growing in numbers among children, unfortunately. So risk factors for metabolic syndrome, genetics play a role. So sometimes some families do have history of diabetes or heart disease and things like that. But more importantly, lifestyle factors are the main driver here. So poor diet is one of the #1 causes of metabolic syndrome. Eating foods that are high in sugar and refined carbohydrates, like your white breads and pastas and cookies and crackers and all of that. Processed foods, seed oils, all of these can really drive metabolic syndrome. Sedentary lifestyle. Unfortunately, a lot of us have desk jobs, so we're not getting up and moving a lot. We're sitting behind desks, so that's another risk factor. Chronic stress, lack of sleep, smoking, excessive alcohol use, drug use. All of these lifestyle factors play a role. Environmental factors also play a role. So we're exposed to a lot of toxins through the air that we breathe or in our water supply. Also the food that we eat. All of these things, there's hormone disruptors in some of these foods and chemicals that we're exposed to. And as we go further on into the presentation, you'll understand a little bit more about how hormones play a role here too. Also environmental exposures can inflame us, and that also contributes to metabolic syndrome. And then age and gender, so the risk increases with age. As we age, our metabolism slows down. We do have less energy generally, so a little bit more sedentary lifestyle perhaps, and risk factors for metabolic syndrome go up, especially among postmenopausal women. Estrogen is really protective against insulin resistance, so after we lose a lot of our estrogen after menopause, this can put us at risk for more insulin resistance. And then ethnicity and socioeconomic status. We know that a lot of different ethnicities are more affected by this than others, specifically Hispanic and African American. And then also if you live in an area that you don't have access to healthy food options or parks and gyms and things like that where you can get activity, that's also a risk factor. So in functional medicine, we love to talk about root cause of things. So rather than going to your doctor and them saying, hey, you have high blood pressure, time to start that blood pressure medication, or your cholesterol is elevated, let's start a statin. We like to really hone in on what really is causing these things and see if we can get to the bottom of it and reverse it. So these 5 things here are the root causes of metabolic syndrome, and they all play off of each other, so you really can't fix one thing without fixing all of them. So chronic inflammation, insulin resistance, gut dysbiosis or leaky gut, mitochondrial dysfunction, and hormone imbalances. So I'm going to talk a little bit about how these kind of all work together. Let's say, for example, somebody has a little bit greater waist circumference, has some abdominal obesity. So like I had said, that visceral fat that's around our organs can secrete inflammatory cytokines. So this can put us in a chronic state of inflammation. And that chronic inflammation can block signaling of insulin and other hormones, so then we become more insulin resistant. And when we're more insulin resistant, we have more glucose that's floating around in our bloodstream, which causes more inflammation because it's inflammatory to be out there in our bloodstream. And our body knows it's inflammatory, so what does it do? It stores it as more fat. So then we perpetuate greater visceral fat, more inflammation, more insulin resistance. Gut dysbiosis, where this plays in, or leaky gut. Do any of you really know much about leaky gut? Heard of it? Yeah. So I'll give a brief synopsis of what it is, but this could be a topic for a whole nother presentation. But basically, our gut lining is held together by cells with really tight junctions so that nothing can leak out of our intestine into our bloodstream, because it shouldn't be out there. And what can happen is when we're eating foods that inflame us, processed foods, if we're exposed to toxins, if we're taking a lot of antibiotics or anti-inflammatory medications, this can disrupt our good gut bacteria and our cell lining. And then those tight junctions open up, and foods and toxins and bacteria can leak out into our bloodstream, which then we have our immune-fighting cells that come to attack those proteins and toxins, and then we have cytokine inflammatory cells that come in, and this sparks this chronic inflammatory state, which then leads to insulin resistance, and you can see the trickle effect, right? Mitochondrial dysfunction, where this plays a role. So our cells have mitochondria, which are our powerhouses of our cells. So that's where our cells get energy to do all of the work that they need to do. So if our cells are impaired at that cellular level, this can lead to all of these things as well. So let's say chronic stress, or already chronically inflamed, or you have mold toxicity or Lyme disease or something like that that's dragging down your mitochondria. This can create, again, first of all, fatigue, which makes you have a more sedentary lifestyle, which can lead to all of these things. So they all play off of each other. And then hormone imbalances is really important as well. Like I kind of touched on before, cortisol, for example, is our stress hormone. So if we're always stressed out and in a constant state of fight or flight, our cortisol is always going to be surging, and that can raise our blood pressure. Thyroid, if you have an underactive thyroid and your metabolism's slow and you're gaining weight and feeling like fatigued, this can also lead to metabolic syndrome. And like I had talked about, estrogen and progesterone being low puts us at risk. And even for men, as testosterone goes down, energy levels and things like that decrease as well. Any questions so far about any of that? Not so far? Okay. So I thought it would be fun to do a couple of case studies to get your brains thinking about what you guys think would be the root cause in these situations. So I have a couple. We'll start with one, and if we don't have to do them all. But basically, I'm just going to read this off, and if you can kind of in your head start to think of what you think was the first thing that maybe sparked this case of metabolic syndrome. So, for example, this woman is a 57-year-old postmenopausal woman. That means she's been through menopause, so low estrogen and progesterone now. She has undiagnosed hypothyroidism, so she has an underactive thyroid, and she's complaining of fatigue and weight gain, which are two very common symptoms of an underactive thyroid. At her initial visit, her blood pressure is 140/90, waist circumference is 39 inches, and her labs reveal a fasting glucose of 102. So she meets the criteria. She has 3 of those key components of metabolic syndrome. Does anybody know what the root cause here, or maybe the first thing that could have set this off? Like out of that list of 5 things that we had gone over. I'll go back and you can kind of see. Was it any of these 5 bullet points here? So she's got an underactive thyroid and low progesterone and estrogen. I'll give it away.
Hormone imbalance.
What's that?
Hormone imbalance.
Exactly, hormone imbalance. Very good. You can have a job here. I'm just kidding. But so yeah, she has a thyroid that's not functioning. That's pretty much like the big one that I was trying to point out here. But basically, if you have a thyroid that's not working, that's going to throw so much off. Your metabolism, that thyroid is also responsible for blood pressure in some cases, temperature regulation. She probably has no energy to get activity in and things like that. So very good. Good job. All right. Case study number 2. 38-year-old male presents with fatigue, joint aches, brain fog, depression for several months. He used to work out regularly, but lately has no energy. He experiences afternoon crashes and has been drinking soda to stay awake. He notices he has sugar cravings more than he ever did before. He's feeling unmotivated and discouraged. At his initial visit, his waist circumference is 36 inches, blood pressure is 126/80, which are both normal. His labs reveal a low HDL of 30, that's that good cholesterol that for him is very low. His triglycerides are very high at 200, and his fasting glucose is 115, which is also high. So upon further questioning, the patient reports having a tick bite a year ago that was followed by a rash, and he never had it evaluated. Any guesses? Lyme, yeah, or a tick-borne illness. So for this one, he probably has some mitochondrial dysfunction that might have started it. He was bitten by a tick. Well, for one, probably the symptoms are not allowing him to be able to get activity in, and then he's drinking soda to get the caffeine and sugar for energy. But also, his mitochondria are probably really suffering. So nice job. You want to do one more, or should we skip it? Last one? Okay. So this patient's a 48-year-old female presenting for abdominal bloating, acid reflux, constipation, and diarrhea that she's had for years. She's been diagnosed with irritable bowel syndrome by her primary care doctor. She's been taking Pepcid for years for her acid reflux. In addition, she suffers from chronic sinus congestion. She's always full of mucus and reacts to everything. She has seasonal allergies, frequently gets hives, and takes Zyrtec, which is an antihistamine. She recently started feeling anxious on a regular basis. Her diet's high in carbohydrates like bread, crackers, rice, because she feels as though these things don't trigger her acid reflux. At her initial visit, her waist circumference is 40 inches, blood pressure 150/90, labs with triglycerides of 170, HDL 48, and glucose of 110. So she has all 5 of the components of metabolic syndrome. Root cause, anybody?
Leaky gut.
Leaky gut, very good. So she's got all these digestive issues, right? And on top of it, she's taking an antacid, which long-term taking those can actually cause you to have poor absorption of your nutrients. So she could have some nutritional deficiencies as well if we checked them, like low vitamin D or low iron and B12 and things like that. And then a lot of our histamine is produced in our gut. So when we have leaky gut and we have all this inflammation, that can cause dysregulation of histamine, which could cause all the rashes and all the hives and allergy symptoms. We also produce a lot of serotonin in our gut, which is what's responsible for a lot of our mental health and feeling happy. So when you have dysregulated serotonin, this can lead to depression and anxiety and mental health issues as well. So this is a good case of leaky gut. She's eaten a lot of carbohydrates, a lot of breads and things like that. Gluten, unfortunately, is a big proponent of causing leaky gut because it actually secretes it causes our cells in our cell lining to secrete zonulin, which causes our tight junctions to have to separate more, and then things can leak out into our bloodstream. So, good job. Was that hard? Not too bad, okay. All right, so now we'll talk about prevention and treatment. So basically, how do we prevent metabolic syndrome? So nutrition is huge. Eating a diet that's a low inflammatory diet, so like a paleo type diet or a Mediterranean style diet, getting in your really good proteins, like lean, if you can get things like grass-fed organic or pasture-raised, that's wonderful. Pasture-raised poultry, eggs, seafood, vegetables, and fruits, and then your healthy oils like extra virgin olive oil, avocado, and coconut oil. Trying to eliminate or at least limit processed foods and eating out. So all these seed oils that are in pretty much all of the processed foods, if you look at packages, they're almost always, crackers, chips, all that stuff is cooked in things like canola oil, palm oil, vegetable oil, and these oils are stripped of all their nutrients and they're just highly inflammatory. That goes for eating out at restaurants. Most restaurants use these oils because they're really cheap. And then also making sure you're getting an adequate amount of vitamins either through your diet or through supplementing. So just, your basics like magnesium, vitamin D, B vitamins, all of these will go a long way. Exercise is really important, so incorporating a mixture of cardiovascular exercise, like walking, cycling, jogging, and then strength training is really important, especially as we age. If we're not working our muscles out, we're losing muscle mass, so really important to do some strength training. As we age, like even up to 65 and plus, balance training becomes really important as well, so that we know how to catch ourselves with falls and things like that. And then even if you don't have the time to fit in going to the gym for an hour or something, doing any type of movement throughout the day, if it's doing 10 jumping jacks every time you walk into the kitchen, or every time I sit down I'm going to do 10 squats just to get that movement in, or going on a walk over lunch, whatever you can do to just move more will be beneficial. Managing stress is really important. We talked about that cortisol being elevated, not good for us, so finding things that help to lower stress, whether that's, deep breathing, hiking, being out in nature, prayer, meditation, whatever helps you to relax. And this also goes with adequate sleep, so aiming for a good 7 to 9 hours of adequate sleep a night. For a lot of us, this is going to require some sleep hygiene, like going to bed and waking at the same time every day, keeping the lights dim late at night, no screen time in bed, not eating or drinking alcohol around bedtime. All of this will kind of help you to get a good wind down routine so that you can get good sleep, because sleep is so important. Gut health optimization, so making sure you're getting all of these good things. Probiotics are gonna are gonna replenish our good gut bacteria that we need for digestion and for keeping our gut healthy. So this is fermented foods like kimchi, sauerkraut, kombucha. All of this stuff is really great for replenishing our good gut microbiome. Prebiotics are foods that are rich in fiber that help feed that gut bacteria. So things like your cruciferous vegetables, onions, artichokes, apple, flaxseed, all of these things listed. Polyphenols are foods that are rich in antioxidants that help to create a perfect environment for this bacteria to thrive. Those are like your berry family. Spices and herbs are wonderful for this, olives, almonds. And then avoiding things that lead to leaky gut. So gluten, dairy for some, processed foods, anti-inflammatories, and excessive antibiotics. Sometimes we do need to take antibiotics, and that's okay. There's a time and a place for that, and that goes for anti-inflammatory medications as well. But just trying to follow it up with taking some good probiotics and try to, help your gut along if you do need to take those medications.
If you're taking a probiotic,
Yep.
how often should you, every day or what?
You can take them every day, yeah. A lot of people do take them every day. That would be great. Unless you're getting a lot of probiotics in your diet, if you eat a lot of fermented foods, then that could be a good source. But if you're not eating a lot of fermented foods, then a probiotic every day would be great. Avoiding toxins is another important component here. So just trying to minimize the toxins we're exposed to. It is difficult in this day and age, but investing in a good water filtration system is a good idea. Really reading labels on your household products and beauty products and making sure that there's not parabens and phthalates, and trying to avoid plastic, trying to not drink out of plastic a lot, or especially not microwaving in plastic. All of these things can play a role. And then also supporting healthy detox of your liver. So our liver is what detoxes all of our bodies. So taking something like NAC, or N-acetylcysteine is the full name. That's something I take every day. I recommend it for all my patients. But it's a natural liver detox, and it also supports antioxidants to keep us healthy. Milk thistle, selenium, dandelion root are some other good liver support that you could take. Treatment options. So now we're going to kind of get into more specifically treating certain things like insulin resistance. Again, dietary approaches are going to be pretty similar. So focusing on that low inflammatory paleo or Mediterranean style diet. Some people do well on a keto diet if they have insulin resistance. So this is a really high fat, high protein diet, really very, very low carb. I don't necessarily know if that's a long-term for a lot of people, if that's sustainable long term, but for some people it can really jumpstart their metabolism and help with insulin resistance. Intermittent fasting can be really beneficial also for people if it's done safely. So this is when go ahead.
What's your opinion of yogurt?
Yogurt? So I think yogurt is, it has good probiotics in it. What kind of yogurt are you eating?
Sugar-free.
Sugar-free? Is it like organic from the farm, like whole? No?
Chobani or
Chobani.
one of those places.
So the thing is, dairy can be really inflammatory for people. The casein, which is the protein in dairy, can really inflame people. I wouldn't say everybody, but it can lead to inflammation and a lot of like mucus production and things like that. So I would say I wouldn't be eating a ton of it, and
but it has protein, though.
It does have protein, yeah. It does have some protein.
Is that beneficial or not when you're looking at focusing on high protein?
I generally would say there's other sources you could get your protein, like eggs and meats and poultry and things like that. Yeah. Also, lactose has sugar in it too. So while there is a good amount of protein in yogurt, it comes with sugar, and for some people it can inflame them. And so I usually would recommend people find other sources of protein. Intermittent fasting can be really beneficial for some people also. So this would be like going, 15, 17 hours potentially with, fasting, sometimes even longer for some people during certain points in the week or month. Continuous glucose monitors are a really helpful tool. So historically, you probably have seen people, diabetic patients generally wearing these continuous glucose monitors. Now people are wearing them just so that they understand their own nutrition. So for one person, something might raise their sugar, but for the next person, it wouldn't. Also, stress and cortisol will raise your sugar. So this is such a helpful tool because it's something you wear all the time. It connects to smartphone, and you can see every 15 minutes it updates what your sugar's doing. So you can learn what are the things that trigger my glucose spikes and stay away from those things. Interestingly enough, I wore one of these, and the things that spiked my sugar the most were eating salads at a restaurant that had the dressing on it. Even more so than eating chocolate cake on my son's birthday. So I was like, no, I wasn't eating salad dressings at restaurants that much before, but now I really won't be. So yeah, these are really helpful. We have some here. They come in a pack of 2. It's the Stello brand. But yeah, they are, you can wear it for 15 days and then switch it out and wear it, even a couple months later and just kind of learn what your body responds to. Regular exercise is super important. That helps with insulin resistance, especially if you go get some exercise, go on a walk for 20 minutes right after eating a meal. That forces the sugar that was just eaten into your cells to be used as energy rather than eating and sitting and letting it float around your bloodstream like we most of us probably want to do after meals. And then some of the supplements that can help with sugar: chromium, alpha lipoic acid, magnesium, berberine, cinnamon bark extract. Akkermansia is a probiotic. It's one of the keystone species that's really good for our guts, and it also promotes us to secrete GLP-1, which is the non-hunger hormone that we all naturally have. So that can help with blood sugar control. These supplements here listed at the bottom are just a few of the ones that we sell here that have some of those things in them, if you're interested.
What supplement do you sell that has the Akkermansia?
That would be this GLP-1 probiotic at the bottom there.
Oh, okay.
Yeah. Okay, addressing cholesterol. So focusing on sources of food that have good cholesterol is important to raise that HDL. So lean, grass-fed organic meats. This I would say to do in moderation. If you do have high cholesterol, I would recommend limiting red meat consumption to probably no more than once a week. Poultry, fatty, wild-caught fish like the salmon, mackerel, herring, sardine fish are really wonderful for raising good cholesterol. Nuts and seeds. Eggs, again, if you do already have really pretty high cholesterol, I would say limiting those to maybe 7 per week, but still eggs are a really good source of good cholesterol, so a good thing to eat to raise your good cholesterol. And then your healthy oils: avocado oil, extra virgin olive oil, coconut oil, and grass-fed organic butter can be a healthy fat as well. Yeah.
What about egg whites? Is that any better than a full egg?
So more of the cholesterol is in the yolk. So in general, eggs are a wonderful source of good cholesterol, and they're a good source of protein. So unless you have some pretty high cholesterol, I wouldn't be worried about eating eggs. But if you do, then I would say, I would say probably just limiting how many eggs in general you're eating would be important. But yes, the whites do have less cholesterol than the yolk.
What about any pointers on bringing up your good cholesterol? That's hard one.
Yeah, so focusing on, like the fatty fish is really going to help with that. Those healthy oils like the olive oil and coconut oil and things like that. Nuts and seeds, chia seeds, all that kind of stuff will help to raise that good cholesterol.
Jackie,
Yeah.
I will say that I started eating beef tallow, like grass-fed beef tallow last year, and cooking with that a lot, and I needed to raise my good cholesterol, and it raised it. Yeah.
Nice.
Yeah.
So yeah, that's another good source. Exercise also is good for raising your HDL.
Oh, sure.
You said you cook with it like instead of oil?
Yeah. It replaced
Okay,
most of the
oatmeal
oil.
and psyllium husk. Has anybody ever heard how oatmeal is good for cholesterol? The reason for that is because some people are over-absorbers of cholesterol, meaning they absorb a lot of the cholesterol from the food that they're eating. Like somebody that has high cholesterol, it could be because they're eating a ton of eggs and they're absorbing so much of the cholesterol, whereas other people are overproducers of cholesterol. Their liver is just producing more. Or people, it could be a little bit of both. But oatmeal and psyllium husk, where that plays a role is it can actually help to block the absorption of the cholesterol that you're getting from food.
But you're not talking about instant oatmeal, you're talking about,
I would say like if you're gonna do oatmeal, I would do like a gluten-free oats, because oats are gluten-free, but a lot of times they're produced in a factory where other gluten products are made, like cereals and things. So a gluten-free oatmeal, but not by itself, always with protein, so that you don't get that huge sugar spike. So I would be putting like nut butter or chia or flaxseed with it, or even eating it with like eggs or meat or something, so that you're not just having a carbohydrate. But that could potentially help to block some cholesterol absorption. If you're eating oatmeal for a while and your cholesterol hasn't changed, then it's probably not that you're an overabsorber. You're probably an overproducer. So, and the psyllium husk, you can get that at natural food stores, and you can try that as well. Regular exercise is important for cholesterol as well, and then some supplements. Red yeast rice is a natural plant-based statin that can sometimes help lower a high LDL. Niacin sometimes specifically can target triglycerides. Bergamot, artichoke leaf extract, garlic, omega-3s are really great for keeping your blood nice and thin. Really good for heart health, brain health, keeping inflammation low. The red yeast rice we have here has CoQ10 in it as well. Addressing high blood pressure, so same thing as far as dietary recommendations. Decreasing stress and inflammation are huge here. Regular exercise, and then some supplements that could potentially help with blood pressure: magnesium, omega-3s, nitric oxide, and CoQ10. Addressing inflammation, so same thing: low inflammatory foods, exercise, lowering stress, all of that, getting good sleep. Some supplements: omega-3s, curcumin, resveratrol. Turmeric is great for lowering inflammation. Periliseed, quercetin. Extinguisher is probably my favorite product that we carry that has turmeric, periliseed, resveratrol, and quercetin in it, and that's really great for inflammation. Even people that have like joint aches and things like that have had success with taking this to help with pain. Supporting detox is really important as well for inflammation. So, like I said before, supporting your liver, NAC, milk thistle, dandelion root, liver sauce, selenium. These are some things that we carry. Infrared sauna is great for this. This promotes sweating and toxin elimination. Red light therapy we actually have here. A lot of times when people get IVs, they'll do red light therapy in there for them as well. But all of this stuff is really great for helping with lowering inflammation. Addressing leaky gut, so a low inflammatory food diet. A lot of times this will be like gluten-free, grain-free. There's paleo is low inflammatory. If you want to even go more hardcore, autoimmune protocol diet would be something that's really good for lowering inflammation. Some people will do basically seafood, vegetables except nightshades, and fruit. So pretty limited, but can be really great for helping to lower inflammation. This is particularly helpful for people that have autoimmune issues that are really trying to bring down that inflammation and heal gut. So some supplements for gut healing: aloe vera, licorice root extract, L-glutamine, immune globulins are wonderful, probiotics or spore biotics, marshmallow root. For many patients, use this Prime Gut Health, which has immune globulins and spore biotics in it, and then GI Foundation, which has L-glutamine, the licorice root extract, and aloe vera. All that soothes the gut and kind of helps to heal it. GI Core, SBI Cap, spore biotics are some other ones that we have here. So addressing hormonal imbalances, so supporting the adrenal glands. Our adrenals are really important for secreting cortisol, also a lot of our other hormones like DHEA and pregnenolone, which are the precursors for things like estrogen and testosterone, progesterone. So supporting our adrenal glands. These are some herbs and adaptogens that are great for supporting adrenals: holy basil, ashwagandha, rhodiola, L-theanine. And then supporting your thyroid, estrogen, progesterone, and testosterone. So this is going to be really dependent upon where you're at and what your lab values or saliva or urine test, whatever we're doing to check hormones, there's treatment plans that we can do based on where your hormones are at.
Are these slides gonna be available online anyplace?
I think can be.
Yeah, yep.
Good.
We'll put this whole video presentation on YouTube.
Oh, okay.
Yeah.
Hormone replacement therapy is also an option for some people, so that's always something that you can talk to your provider about as well. Addressing mitochondrial dysfunction. So, basic vitamins are really important for mitochondrial function, like your vitamin D and B vitamins. And then in addition, things like CoQ10, urolithin A is wonderful for mitochondria. We have a product called MitoSpark that's great. And then other treatments like the red light therapy, the infrared sauna, pulsed electromagnetic field therapy is another great thing you can do, or hyperbaric oxygen therapy. And I can explain those if you guys would like.
Where should your D level be about?
So the optimal vitamin D level we would say would be about 60 to 80. Yeah.
For all people, for all ages?
Yeah, all ages. The range that we get from, generally I work with most of the time, my patients get labs through LabCorp, and the range it's normal if you're 30 to 100, which is huge. So 60 to 80 is really the optimal level. Even up to 100, I would say is okay. Once people hit 100, I'm kind of like, we could back you off a little bit on that vitamin D. But yeah, 60 to 80 is optimal. It's great for bone health, immune system health, hormones. It's a wonderful thing that we all need to make sure we're getting enough of. Especially, we've been getting so much rain. Now the sun's coming up, so hopefully we'll be getting more vitamin D. Any other questions about that slide, though? Anything? Oh, you want me to go back to that one? Okay. So the role of testing in functional medicine. So we do a lot of comprehensive blood panels. So trying to look at things before they're an issue. So at a primary care doctor, they might check fasting glucose and a hemoglobin A1C. And the first time you get a hemoglobin A1C check, which is a 3-month average of what your sugar is doing, they might be saying you're diabetic. So, and that should never happen, where you get blood work and the first time you're hearing you're diabetic. So we can see these things coming for years ahead. So an insulin resistance level is really important. Sometimes that's the first thing that will be high before you're even pre-diabetic. And we can say, look, you have insulin resistance. Like, if 5 more years from now, you'll be pre-diabetic. So let's make some changes now. Also, we do really in-depth cholesterol panels. There's a huge drive for getting cholesterol lower. Everybody's talking about we got to lower cholesterol. Cholesterol is really important for hormones and for energy. So if you have some high cholesterol, but you have really low sugar and really low inflammation, is it really a really huge necessity to drive those numbers down? Maybe not. So we look into a lot of things and try not to put everybody in this box that meets all these specific protocols.
Are they still saying that the HDL sort of cancels out some of the LDL?
Like the ratio? Well, I would say, I think it's dependent on each person. And also there's a lot of other numbers that we're looking at more specifically for risk of heart disease, like ApoA and ApoB, which are actually the carriers of your LDL and your HDL, and those numbers can be a lot more indicative of what your risk for heart disease is. Another one, Lp(a), this is a hereditary marker that shows whether or not you have a long sticky tail on your cholesterol. That puts you at even greater risk of heart disease. And people that have this sometimes are people that are having heart attacks in their 40s. So that's a really great number to have checked to know whether or not you have that. So yeah, I think it kind of depends on that's why it's good to look at all the numbers. Nutritional values are really important too. What's your vitamin D, B12, magnesium, iron, all of these things play a role. If you have a really low iron and you can't, hard to get up in the morning, you wouldn't know that you have a low iron unless somebody's actually checking that. And then also your basic labs like complete blood counts, complete metabolic panel, which looks at kidney, liver function, all your electrolytes, checking inflammatory markers to see, do you have a lot of systemic inflammation, and if so, what can we do about it? Hormone testing we also do, so looking at cortisol, thyroid, sex hormones. And then additional testing, we can do stool tests to check how your gut bacteria is. Do you have enough of the bacteria that you need? Do you have an overgrowth of yeast, or, you know, and these tests generally are done if you have, are you having a lot of gut issues or pointing to leaky gut, we can do that as well. And then imaging, sometimes we'll order coronary calcium CT scans for people. Let's say you have some high cholesterol and you're not really sure whether or not you should go on a medication or what you want to do. A CT scan that looks at your coronary arteries to show if you have plaquing going on can be really helpful for making those types of decisions. And there's a lot of other testing, you know, like looking into tick-borne illness or heavy metal toxicity and all that kind of stuff. So, key takeaways. Metabolic syndrome is a complex condition, but it's highly preventable and manageable through functional medicine approaches. The root cause can include insulin resistance, inflammation, gut dysbiosis or leaky gut, mitochondrial dysfunction, and hormone imbalances. And then the prevention and treatment focuses on lifestyle changes like nutrition, exercise, stress management, sleep, and targeted supplementation. And functional medicine provides personalized, holistic care to address each patient's or person's needs. Any questions?
That NAC
Yeah.
that you talked about, I'm not familiar with that. I've never heard that. Can you
Yeah,
say a little bit?
N-acetylcysteine is the full